In the research realm, one of the major issues for traumatic brain injury, particularly MTBI slash concussion, is really understanding the natural history of it. What happens to people who have concussion, who have repetitive head impacts? The issue is, how many of them are going to go on to have CTE? So the natural history of concussion is something that's still a question. So a significant part of the funding that I was able to manage as the director of the trauma research program has gone into major longitudinal studies of the chronic effects of neurotrauma. We actually established a partnership with the NCAA to develop a consortium called the CARE Consortium, which is going to be a 30-plus year longitudinal study of athletes, both in civilian academic centers as well as the military academies, and follow these individuals for 30 years to find out what happens after their concussion. That itself, just thinking of, like, for heart disease, what the Framingham study has done is changed the way we take care of heart disease. We believe that just getting this major understanding of what the long-term sequelae are and the genetics, all the things that relate to how somebody does, will help us really develop more refined treatments for people. And maybe the point there is also that it may be better to tell some people you have a really sensitive brain, so you maybe shouldn't do that high impact activity. Maybe there's something else you should be doing instead. Just understanding the risk factors. So that itself is going to be a major thing. It's going to take a long time. However, there are a lot of other things that have really gone on. There's been now well over 1,000 projects that have been funded by this bolus of funding that's come through. Being able to come up with better diagnostic tools. So there are several products that are now on the market to really aid to understand when somebody has a significant concussion or when it's something that is just a temporary, that really doesn't impact what their future activity is. So being able to assess the individual, so diagnosis, lots of activity there, and FDA approved products on the market now from that. Treatment, a lot of work on trying to come up with medications that will help to reduce the inflammation that occurs after a traumatic brain injury. Still don't have any approved through the FDA yet, but there are several in advanced clinical trials now that really are looking fairly good. Doing other techniques, the whole area of retraining the brain. So the idea that the brain continues to adapt throughout life. It's not just up till the age of 5, but we can actually retrain the brain throughout life if we know the proper techniques on how to actually train the nerve circuits. So being able to use advanced techniques, advanced EEG techniques that actually measure the wiring in the brain, looking at the advanced imaging techniques of how that connectivity is affected, and then being able to develop cognitive rehab training modalities that work at the basic wiring level of the brain, and then improve the basic connections, improve the working memory, improve the executive function, the memory recall, and the ability of the brain to respond to high activity and stress. The major advances that have occurred in the last 15 years on that. So the point there is, don't just ignore it. Don't go into a dark room and hide away. Go get help and get the proper modalities that are going to actually help the brain heal.